there's a whole range of keynote speakers and presenters that are going to be very exciting, but we focus on the interaction between the people who actually come. I think what's been so exciting about our previous conferences is that people actually engage, and we try to find as many ways as possible for people to be able to talk to each other. I think the other thing that's different about an Altering States conference is that we try to get as many people with a lived experience there as possible. So in 2007 there were 350 people who came, and more than 120 of those were people with a lived experience. It completely changes the dynamic and the feel of the conference and makes everyone know why they're there and what they're talking about, and it keeps it real.
So enthusiastic and so passionate about all of this, and I think that's the one thing I have noticed since being here as well, is that passion that everyone's displaying about being very real about this kind of stuff.
Recovery-based practice is not necessarily having the answers. It's about our ability to keep asking questions.
And that's to move away from this model based on illness and chronicity to one based on recovery.
Basically, I knew that this conference was going to challenge some of my beliefs and ideas about mental health and the mental health system.
But we've got to free ourselves of the illness model. We have to. It's wrong. There's no evidence for it.
We've had 13 or 15 years of national mental health strategies, and yet everyone feels there's not been a lot of change. We want this conference to come up with some answers. How are things going to change? What do we all need to do? What is each of our part? We can no longer blame government or blame services. We need to each identify what our role is in changing the mental health system, and that's what we're going to debate.